Hi, I'm Dr. Jyoti Kapoor, Consultant Psychiatrist based in Gurugram. Digital healthcare has been an area of interest for many startups in the past decade, and many healthcare service apps have come up offering online consultation and support even before COVID pandemic hit. As a psychiatrist, I have had a major interest in field of telepsychiatry, largely because patients from remote areas find it hard to find medical specialists, especially psychiatrists, in their locality. And at times when they meet us here, they are not able to maintain a follow up. Now, it's all the more important in the sector of mental health because assessment and psychological interventions can be made easily through video conferencing methods. But lack of proper guidelines, inadequate infrastructural support, and fear of legal consequences has kept most medical practitioners off the grid for telemedicine services. I remember as a medical director and advisor to an upcoming telemedicine portal way back in 2013, I had put in hours of discussion and research looking for solutions to such problems. But lack of adequate web access, internet speed variabilities, and applications providing easy video conferencing approach deterred many a practicing clinicians as well as patients to acknowledge telemedicine as a valid approach to impart and receive timely health care. COVID lockdown created an urgent need for long distance healthcare, and fortunately, the long pending guidelines for telemedicine practice were released in March of 2020 by Ministry of Health and Family Welfare. Since then, the online services for consultation and treatment have been given a major thrust. We are imparting psychiatric advice and psychological counseling via video applications on a regular basis. Many clients from far off places, as well as elderly people, are preferring this medium to follow up with their doctors for chronic illnesses and maintenance of clinical care. The digital market for telemedicine service is likely to grow further as internet coverage becomes wider and faster, and online lab and pharmaceutical deliveries are made widely available. The challenges in India at present are largely technical and medical legal. The internet speed and bandwidth is variable at different places, causing communication breakdowns and hence dissatisfaction or inadequate intervention. From a medical legal perspective, doctors face challenges because of limitations of technical assistance, proper guidance, and support from authorities, as well as high expectations from patients who sometimes seek emergency intervention online, which can't be provided easily. The mushrooming third party applications focusing on financial and professional growth offer such options like 24/7 medical support, which gives a sort of a false hope of immediate intervention and cure, like pizza delivery, which makes the whole process commercial and exposes health sector to ethical erosion. Personally, I find telemedicine services optimal for maintaining regularity of follow up and continuation of treatment for those who are in maintenance phase of treatment, as well as those patients who are unable to visit the OPD due to distance or disability. As of now, this is what we are able to do easily. We need clearer medico legal guidelines and safeguards to ensure quality intervention. Healthcare cannot be and should not be treated like a commercial service, a sort of a delivery system, because doctor patient trust is vital and limitations exist despite best intentions when it comes to diagnosis and response to medical intervention. In India, we are prone to breaking queues to get things faster. We often don't keep appointments and disregard value of other people's time and expect service providers to be responsible for service, but the recipients are not worrying about their duties that much. Now, if we want to change that, we need to change our mindset so that services can be enjoyed without compromising anybody's interests. Eventually, digital health care, especially mental health care, because of high needs of our population and dearth of well qualified mental health practitioners, is very important. While COVID provided an opportunity to increase acceptance of online platforms to impart and receive psychological support, we hope to achieve high standards of care and maximum positive impact of this phenomena to all sections of society. I hope we'll be able to achieve that soon. Thank you.